Doc is In is sponsored by Amada Senior Care.
Fox 56 News Chief Medical Contributor Dr. Ryan Stanton back in studio.
He's telling us to listen up when it comes to a certain ringing sound in our ears.
And this is not a pleasant ringing sound for a lot of people out there, and many out there watching can relate to this. So we're going to talk about tinnitus. So pay attention. Okay. Here we go. Ringing in the ears is common complaints among adults. The range is wide, but studies show that between about 1 in 20 and 1 in 3 adults suffer from tinnitus. People describe the sound as a buzzing, whistling, ringing, or hissing, or even a chirping noise. I actually deal with this myself due to a history of playing drums for years. And for those old enough, it sounds like the high-pitched sound of an old box TV. For young kids, it's something you don't get to enjoy. The major contributors to tinnitus are an age-related hearing loss and extended exposure to loud noises. Other conditions associated as well include ear conditions, trauma, cardiovascular disease, autoimmune disorders, and certain medications, including and also certain lifestyle choices like alcohol and smoking. Unfortunately, there are very few effective treatments, though we're making progress. There are treatments that can help, including sound therapy devices, behavioral therapies, and medications. The best approach is prevention. This includes limiting exposure to loud noises when young and addressing hearing loss early with hearing aids. And we've talked about that before, where the hearing aids early is actually better for preventing hearing loss, actually preventing or delaying the symptoms of Alzheimer's or other dementia as well. So there's a lot of things that we can do. It's a thing that a lot of people deal with, and the treatments are starting to finally catch up with it.
My dad has it. He's 86 years old, and it drives him crazy.
Yeah, well, I was going to say, Paul mentioned the earpieces that we have in our ears. Is that, setting us up for failure?
Well, a lot of it has to do with the volume. The volume that most people keep with earbuds, and that's my concern about young people, is the earbuds with the volume that they have can be damaging to the ears, and so we're likely going to see more with the amount of time people have things in their ears.
Well, I know that with my headphones, if they're too loud or I'm wearing them for too long, it does give me a notification. So that's something to look out for.
And if people around you can hear it, they are too loud. And next week we leave for the Daytona 500, and next week we're going to have some segments from there for the Doc is In. So Doc is In from Daytona next week.
Cover your ears there too, please.
I will have several things on to protect my ears.
We're going to bring back the boom box. I think that's what's coming back. That'll be better for you.
Kids, that's the 80s.
Boom box. You heard it.
I know what a boombox is. I'll be right back.